Hello and welcome to our ACAP lecture series. We are going to speak today about school mental health. How can we equalize the playing field amidst COVID-19? My name is Erica Rist and I am one of the two schools committee co-chairs for ACAP, along with my illustrious colleague, Dr. Shashank Joshi, who's going to introduce himself in just a minute. And we are going to be presenting this lecture together. We don't have any disclosures or conflict of interest for this particular lecture. I will give you a little bit of background on my interest in school mental health, and then Shashank, Dr. Joshi, will also give you a little bit of his background and experience in mental health. I have been interested in school-based mental health really since fellowship, and have been consulting to my local Washoe County School District in Reno, Nevada, where I am at the University of Nevada in Reno for about the last 10 years or so. I supervise child psychiatry fellows in their school consultation rotation for our local school district. And then over the last 4 years or so, I switched my affiliation actually into the University of Nevada, Reno College of Education and Human Development, where I've been able to be involved in a lot of really fun school-based projects, including federally funded SAMHSA Project Aware, which was a national funding effort to get school-based mental health programs into pilot school districts. And I've also been involved in doing some Project Echoes on school-based mental health. And over the last few months, I've been really involved with our local school district on their reopening committee to try to figure out how to safely reopen our schools and get our kids back learning despite our current crisis. So that's a little background on me. And I'm going to switch it over now to my colleague, Dr. Joshi, and he can talk to you a little bit about his background.
Thank you, Erica. Well, welcome everyone. It's great to have you here. As Erica said, I'm co-chair of the schools committee. And as you might imagine, we've been pretty busy. I've been doing this work for more than 20 years. I'm a professor at Stanford University in the School of Medicine and also appointed in the School of Education, where, like Erica, I've had a lot of very unique opportunities to engage in school mental health, not only thinking about research, but also in thinking about newly minted teachers and getting them to think about how to grow their versatility in the classroom as trusted adults. So this has been such a privilege for me to get invited to do this talk with Erica. And my main areas that I've been thinking about lately related to COVID have to do with how do we help buffer some of the distress, not only with students and families, but especially with our teachers and our communities as we enter this very interesting time in our history for children and youth returning to schools. I've done a lot of work in suicide prevention as well, and in culture, mental health in schools, and the interplay among those three areas. One of the things we're going to be doing is sharing a lot of resources for you all. And some of the resources really is a parallel process to what we do in schools. You're going to hear resources from our psychology colleagues, from our social work colleagues, as well as from our psychiatric and primary care colleagues. And that's in the spirit of what we do. School work is village work. Mental health is part of overall health, and our students have to be healthy enough to learn. And that is why child psychiatrists get involved with schools. So with that, I'm going to turn it back to Erica to take us through some of the things that provide some opportunity to allow us to help level the playing field. Erica?
Great, thanks, Shashank. So these are our learning objectives, and we hope by the end of this talk that you will be able to describe ways in which the COVID-19 crisis has highlighted educational disparities, but particularly within specific populations of school-aged youth. We hope that you will be able to explain how changes in educational delivery models due to COVID-19 may impact student mental health, particularly in socially disadvantaged populations. And then finally, I think this is the most important part of the lecture, to be able to list and utilize tools and strategies that schools can use to improve the mental health and educational progress of all students in our new COVID-19 environment. And as Shashank said, we hope to give you lots of resources so that if you choose to help out with this exciting work of child psychiatrist consultation in school mental health, we hope to equip you with lots of tools for that. So first of all, just to kind of put everything in context, this is not news to anyone, but COVID-19 and school closures are a major issue worldwide. This is, I think, a very succinct but powerful quote from a very recent United Nations policy brief on education during COVID-19 and beyond from August 2020. And the quote says, "The COVID-19 pandemic has caused the largest disruption of education in history. By mid-April 2020, 94% of learners worldwide were affected by the pandemic, representing 1.58 billion children and youth from pre-primary to higher education in 200 countries. And although we are going to focus the majority of this talk towards our country, the United States, I think it's important to remember that this is, just like the pandemic itself, a worldwide problem with huge ramifications really for all children across the globe. So again, to put everything in context, there are many adverse consequences of school closures. The school closures of spring 2020 were necessary for public health reasons, and they had many adverse consequences, particularly for children and youth. And here are just some of the consequences from the resulting interruption in education, interrupted learning. We know that many youth across the world went through large periods of gaps in time where they did not receive any learning or perhaps very limited learning. This was very confusing and distressing for teachers who had to very rapidly shift to alternative delivery models such as distance learning without really preparation or tools or even training to be able to do that. And yet they were still responsible for the educational well-being of their students. So many teachers were understandably very distressed. The distress also influenced parents. Many of you, I'm sure, experienced this directly. I know I did. In that suddenly parents had a lot more responsibility for educating their children. As many schools moved to distance learning models, children were at home and parents needed to supervise and support their children at home, despite the fact that for many parents it was an almost impossible challenge between trying to balance their own work demands, needing to supervise their children, perhaps not really having the educational background to teach. And so that was very problematic. Additionally, there were challenges creating, maintaining, and improving distance learning. Again, with having to transition so rapidly to this model, many were unsure about how to do this properly or right. Gaps in childcare. So, and I saw this a lot in my private practice, I'm sure many of you did, that many of the teenagers were at home alone doing quote distance learning as parents were at work if they were essential workers. And so you had a large cohort of children who would normally be supervised who were no longer supervised. And that, of course, leads to all kinds of potential problems such as substance use, engaging with deviant peers, all those kinds of things. Poor nutrition. So many of our country's children get nutrition supplementation through school, through free and reduced school lunch programs, as well as other types of nutritional supplementation. And although many school districts did try to maintain those programs, there were gaps in that as well during the school closure time. Possible increases in domestic violence and child abuse. So with families being sheltered at home, those families more at risk for domestic abuse were in pressure cookers, where families were spending increasing amounts of time together with very limited ability to have distance. And then, as we know, across the country, adult substance use rates went up, and that is also associated with child abuse. So we anticipate that as we start to gain more information about what has happened during those months of school closures, that there have been many more children exposed to domestic violence and abuse. This came at a high economic cost. Many of our workers were unable to work because they had to stay at home to supervise their children, which resulted for many in terms of loss of income. This also put an unintended strain on the healthcare system, where essential workers, if they needed to stay home with their children, were unable to work, and therefore we had fewer people trained who were able to address the medical needs of the crisis. For those schools and school systems and childcare centers that remained open, there was increased pressure on those schools as they had to absorb, for example, the children of the essential workers who did need childcare and schooling. Other unintended consequences or adverse consequences, rise in dropout rates as children became disengaged and began to drop out from participation in school. Across the globe, increased exposure to violence and exploitation. There's research and data that suggests that, for example, when girls in developing countries do not go to school, they're more likely to be married off at much younger ages and not be able to continue to receive schooling. But the social isolation that we all are very concerned about is a big adverse consequence. And then finally, challenges measuring and validating learning. And this gets at some of the standardized testing that is utilized to measure how children are progressing. Many of those types of validated learning instruments got disrupted during the time of the shutdown, and this has created a lot of stress, particularly, for example, for children applying to college who were unable to take their SAT tests, and what does that mean for their future in applying for college. So as you can see, many potential adverse consequences for school closures. And as this lecture is really going to be focused on disparities, we want to make the additional point that all of these adverse consequences are magnified for those who are socially and economically disadvantaged. We did learn some important lessons from the school closures during spring 2020. And some of the research that really demonstrates the negative outcomes include a survey, 2 national surveys conducted in March and April of 2020, where 2,600 teachers and school district leaders were surveyed by the EdWeek Research Center. The reference is there for you if you would like to look at it directly. I have pulled out what I think are some of the most important points from this research. The first, and this is kind of a no-brainer, but it's nice to have the data that really supports it, big gaps in technology access across our country. So, and just to orient you to this graph, the 4 bars really represent different quartiles of school districts at different income levels. So the top box there in purple are the higher income school districts throughout the country. The bright blue bar below at the bottom are the school districts that have the lowest income students. And so you can see for our highest income school districts, we still had some gaps in technology. So 21% of students, even in the highest income districts, had lack of access to technology. But then when you get down to the lowest income school districts, we're talking about 64%. So a huge gap in access to technology. Secondly, significant truancy. Truancy is in quotes. Really what that means is that these were students who, for whatever reason, and I'm sure there were many reasons, including lack of access to technology, were unable to participate or did not participate in the distance learning that occurred across spring 2020. And so if you look at this graph, this is the percentage of teachers who said their students were unavailable, truant during coronavirus-related closures. And so again, the higher income districts, 12% of those teachers said that they missed some of their students versus 32% of the lower income districts. So that is a huge discrepancy. We're talking about in the lower income districts, at least a third of students were missing from the educational opportunity. This one I think is important as well. So higher poverty schools were less likely to offer live instruction. We know that it's harder to engage students over distance learning. Later on in this talk, when Shashank is going to talk about strategies for school districts, you will see that a lot of those strategies are really about engagement of students. How do you engage students when they're not physically present in the school building? And so what you see is that even the higher income districts over spring 2020, only about a third of them, 29%, offered live classes where there could actually be real-time interaction between teachers and students. But when you get down to the lowest income districts, 14%, only 14% of those districts offered live in-person instruction, which again is probably the highest caliber in terms of engagement. So you see again a huge disparity where the higher income districts were more able to engage in real time versus the low income districts had almost little capacity. Only 14% of them engaged in that particular strategy. Finally, this slide talks about how rural, urban, and high poverty districts were far less able to reach students during the school closures of spring 2020. So, so this slide looks at what percentage of district leaders said they were able to provide online learning opportunities to all students, meaning equitable provision of learning. And you find that the district leaders in the high income districts, about 73% of them felt that they were able to reach all students. That's not bad. Similarly, if you look at the graph below, on the orange, that is the suburban school districts, and I'm not sure why the number is cut off, but it's 62% of leaders in those districts said that they were able to reach all students. But then when you look at the low income districts, only about half of them, 54%, felt that they were able to reach all students. And in the urban districts, only about 43%, and rural only about 42%. So again, huge disparities, both geographically and also income-wise, in terms of which districts were able to reach all their students versus districts that had trouble and really lost some students, had students falling through the cracks. And that's what we're really, really concerned about, because unfortunately those students that fall through the cracks are the most vulnerable students and the ones most at risk for those adverse consequences that we spoke about. This is a very, very interesting report. We gave you the link there because you may be interested in looking at it. The report is called COVID-19 and Student Learning in the United States. The Hurt Could Last a Lifetime. This is a very interesting statistical analysis by McKinsey & Company that did some statistical modeling to try to estimate the long-term damage of COVID-19 related school closures on those populations most at risk, low-income Black and Hispanic Americans, and also on the US economy. This study created 3 statistical models to estimate the potential impact of school closures on learning. They had 3 different groups of potential students. So those who experienced what they called average quality remote learning, those who experienced low quality learning, meaning that the distance learning that was provided to them was not as high quality, not as engaging, not as based on evidence-based practices, and then finally those students who got no instruction at all. And then the statistical models were created for 3 different epidemiological scenarios. So the first, which I think at this point we can all say is highly unlikely, is that the virus would be contained by fall 2020 and in-person instruction would resume. I think it's fair to say that that's not happening. And that, as you can imagine, you'll see in the data in the upcoming slides, is the best case scenario. The other 2 scenarios, there's sort of a medium scenario, which I think is probably the most likely scenario, where we're going to have intermittent school closures and part-time schedules, at least through January of 2021, where schools will be alternating between in-person and then distance learning as COVID-19 infection rates spike and then go back down in communities. That's the most likely scenario in my estimation. And then finally, the worst case scenario is what they call pandemic escalation, where schools would have to operate remotely through distance learning for the entire 2020 to 21 year, which unfortunately is a possibility. So we will see how that ends up. So you will see now the data based on these statistical models. And this looks like a complicated slide, but it really isn't. So I'm going to walk you through it. Again, we talked about the three scenarios. Scenario one, which I think, again, is not going to happen, where everything would go back to normal in the fall. Scenario two, which is sort of the medium scenario, which I think is the most likely, where you have some back and forth between distance learning and in-person, with a return to in-person in January of 2021. And then scenario three, which is basically where you have a full year of distance learning. Those are the three scenarios. And then if you look at these lines, the top line, the black line, is if things were totally normal. So kids learn at typical rates in classroom instruction. And this is, the modeling here is based on estimated math scores. So kids improving their scores in math. And, you know, for typical learning, over time, kids' math scores go up. You see a couple little dips here, and that it correlates with what they call the summer slide, which is there is usually a regression of some skills over the summertime when kids are out of school. But otherwise, you have sort of a nice general trend upward in scores. That would be if we were in normal times, which we're not. Then the second one, which is, you know, this would be kids who are getting remote learning, but it's fairly high quality. They call it average quality learning. So for that scenario, as you can see with this kind of lighter blue line, there's not as much academic progress, but there is some academic progress over time. Then if you have the third group is the low quality remote learning. Well, those folks sort of have either a plateau and then kind of just going down in terms of their scores. And those who have zero instruction, this last bottom line, you just see a slope that goes down, 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 down with lots of loss of learning. And then these three bars, I think down here is another way of looking at the data. What they did here was they looked at average months of learning loss. This is just for the middle scenario, the scenario of, you know, back and forth distance learning until January 2021. And for that one, for the students that get, you know, okay, average, pretty good quality remote learning, 3 to 4 months lost. For those students who get low quality learning, 7 to 11 months lost. For those who get no instruction, basically a year lost, 12 to 14 months. So that is rather staggering. And if you look at particular vulnerable subpopulations, the story is even worse. So this slide looks at, again, the three different types of instruction, either average and above average remote instruction, low quality versus no instruction. For overall, they think about a third of kids across our country will get average to above average. 48% will get low quality, 20% none. But if you look at some of our populations of interest, the data look very much worse, where you can see that with the low income kids, you got none of them getting average and above average remote instruction, and 40% of them getting no instruction. And similarly for Black and Hispanic groups, much fewer rates of the higher quality instruction. This translates, this is a different way of looking at it. Again, average months of lost learning. So you can see for the low income group, 12.4 lost months versus 6.8 months overall. And then this translates into economic impact. And that's kind of the thrust of this article. I think it makes a really powerful argument for how loss of education during critical periods translates into overall loss of economic prosperity across years. And that's the reason why this article was titled, that it's going to be hurt that could last a lifetime. So here you see economic impact. So loss of learning leads to loss of earnings. And on average, overall, for our entire country of kids, we're looking at a loss of about $110 billion or so. This tells you number of kids affected, their average annual earnings lost, and you can see again, it is most grim for our vulnerable populations, where for Black students, the education loss because of COVID-19 could result in average annual earnings loss of $2,186 as opposed to $1,785 for the overall population. So this just goes to show the long-term impact of the current crisis and its impact on educational losses. This slide talks a little bit about the impact on mental health, which of course is very interesting to us as child psychiatrists. This is a really nice graphic that I cut into 2 slides. If you want to see the whole printout, you can go to this website, which is from the Mental Health Technology and Transfer Center. If you're not familiar with it, it's a wonderful resource. And they did a really nice job of putting in graphical form some of the evidence that really points to the mental health impact of these school closures. So you can see 60% of children live in countries that are under full or partial coronavirus lockdowns. 1.5 billion children across the world are out of school. 99% are living with restrictions on movement. Girls are particularly affected, younger children at greater risk. And then this slide really gets at some of the mental health impacts. So this gives you nice little links actually to data. This first slide talks about the new pediatric autoimmune syndrome that seems to be related to COVID, which is more of a medical issue. But then this was actually a study from China that looked at children who were in home confinement as a result of school shutdowns. And as you would expect, they found higher rates of depression and anxiety compared to baseline rates. It's not too surprising for us as child psychiatrists. And then this middle section here talks about how we have challenges in terms of documenting disparities and collecting racial data on coronavirus because it's not being collected in any kind of a standardized way. And then these last 2 blocks, again, talk about increased risks, increased rates of anxiety and depression in children as a result of the school shutdowns. The COVID-19 survey with the faces there found that 4% of US kids surveyed reported feeling worried, 25% reported being anxious, 19% reported feeling helpless, and 35% reported being scared. Those are pretty big rates. And then this last block talks about post-traumatic stress disorder. This is actually based on previous pandemics in Canada and Mexico, where they found that during pandemics, about 30% of children met criteria for post-traumatic stress disorder. So this just validates what we already have an instinct about as child psychiatrists, that our child population is really highly at risk right now because of the COVID pandemic and the school closures. And of course, the subpopulations of children who may be at higher risk include low income, racial and ethnic minorities, rural, English language learners, children in transition, children with disabilities, and LGBTQ children and youth. So these are the children groups that we should be particularly worried about and particularly focused on as we try to think about ways to support and help. The last two slides here, just to kind of drive the point home a little bit more, looking at some of these specific subpopulations. So there was a survey looking at parents of children with disabilities. Those parents have very high rates of depression and anxiety currently, which, as you can imagine, you have a child with a disability, they're not going to school. You as the parent are responsible for educating them. It's generating tremendous amount of depression and anxiety for those groups and those parents. And again, I'm not going to belabor the fact too much. These are in your slides, but it just shows you how much more anxiety parents of children with disabilities have. And then this one talks about how depressed parents of children with disabilities are feeling. And then this last slide talks about COVID-19 risks for LGBTQ youth, which is another group which is highly at risk. And that partly has to do with the fact that for this group, home is oftentimes not a supportive place. So nearly half, 48% of LGBTQ youth report that they have parents that make them feel bad for being LGBTQ, and only 24% of them report that they can be themselves at home. Stay-at-home orders means that they have no escape from those home environments that are unsupportive. And as we know, suicide rates in general are higher in this group, and suicidal ideation can be precipitated by the social isolation associated with quarantine. So I've just given you some really grim information that really worries me, and I'm sure worries you. But the good news is that Dr. Joshi is going to give us all kinds of strategies that we as child psychiatrists can promote to try to help with these problems and equalize the playing field for these children. And so I am going to, at this point in time, switch over to my co-chair, Dr. Joshi.
Thank you so much, Erica. That was really interesting and compelling, and I am going to take you now hopefully to some things that may provide some hope. And I want to thank you, Erica, for doing the lion's share of the work here on this. I feel like it's been such a privilege to be co-chair with you and before you, Cheryl Kataoka. At ACAP, we just have so many resources, and the resources are each other. And it's one of the things that keeps us really going in this work. Even in the face of very difficult crises, we have the opportunity. And so that's the slide I'm actually going to start with, which is, and here my apologies for anyone who can get this pronunciation way better than I can. But you may know that in Chinese, there's a saying called wei ji, and wei means danger or crisis on the left side here, and ji means opportunity. In English, crisis is only one word and one meaning, but in Chinese, crisis translates to wei ji. So if we think about Taoism, and this is from this wonderful website, wudongcheng.com, we teach some principles of Taoism in one of the classes that I run at Stanford called The Psychology of Stoked, where we teach about the neuroscience of well-being and positive psychology. And we talk a lot about this. Out of crisis comes opportunity. So Taoism talks about things having two sides. So when there's danger, there must be opportunity present. And so if there's a yin side, there's a yang side. So looking at positive and negative always as one, always together. So the example that Wudongchen likes to give is like, without an instructor, there's no student. If there's no student, there's no instructor. And so in the same way, we need to think about this. When an issue shows up, there's also an opportunity. We can really pay attention to some of these inequalities in our learning system that have been present for so long. And now we are all kind of in the same ocean. We are in different boats, as Erica showed you, based on whether we are in a low-income category or not. And I presume that most of you watching this this webinar don't find yourselves personally in the low-income category, the majority of you, but many of you are working with communities that are very diverse. And so part of this really reminds us to think about the opportunities. And for example, not all distance learning is bad. So some research suggests that students retain much more material, 25 to 60% more when learning online. E-learning requires less time to learn than in a traditional classroom because students can learn at their own pace. In fact, some of the data coming out of the San Francisco Bay Area, the 9-county Bay Area here, shows that some students felt empowered by this during a time of very little control otherwise. And that goes for students from low income as well as higher income areas, for those who actually got e-learning. So again, to highlight the idea that some kids just totally withdrew. And some of the teachers that we work with are really, discouraged when there's a synchronous session and not all the students are there. So they go to a place of like, well, where's this student? Where's that person? I've been worried about this student. So part of what we think about as child psychiatrists is not only how to support students, but in particular, supporting the helpers, supporting the teachers, helping them to develop some versatility, not only around self-care, but also around attunement. What are the things in class on a Zoom session or other platform that can tell you that maybe something's going on with a student? So new technology can offer creative engagement tools, everything from video meetings and polls to document sharing using the whiteboard. And that does require that the teacher be very facile with whatever the virtual learning is. So it's also important to make sure that the teachers have the tools they need in order to really capitalize on this online learning opportunity that may actually catalyze a shift from the way that we have been teaching over the past, 100 years. So continuing along the theme of out of crisis comes opportunity, we may be able to do this well if it is done well with access for all. So as I said before, I think there is now growing recognition of the mental health challenges created by COVID-19 and really paying attention to health promotion. Some of you know we have a very active and engaged health promotion and prevention committee at ACAP, and I think we are finally at the table thinking about prevention, thinking about positive psychology, thinking about social emotional well-being. And so here in Santa Clara County in the Bay Area, we've been very engaged with 15 school districts. We're going to be expanding to all 32 in the next year, increasing the incorporation of social emotional learning curricula, increasing screening and early identification, really making sure that we are integrating emotional health with academic opportunity and seeing the two as integrated as we think about the multi-tiered systems of support. So in California, we actually are fortunate to have a law that passed in 2016, and then again in 2019, it was updated from K through 12. Every one of our 58 counties, school districts need to have a suicide prevention policy that allows for using instructional time to teach not only about suicide prevention, but also about basic mental health in the classroom. What does it look like? What is mental health? What is mental illness? How do I know the difference? How do I get help for myself or a friend? And really, again, highlighting the idea that mental health is part of overall health and students have to be healthy enough to learn. So again, child psychiatrists can really help to make this happen. And this is probably a review for many of you, but it's a nice little cartoon that Erica put together. That prevention and early intervention really works. We know that to be true, not only with regard to autism, but even when it comes to things like depression and anxiety. We can actually support a great majority of our students in schools, without the use of pharmacotherapy, at least in the beginning, because many of these students are presenting in relatively mild states. So if we can really attune the teachers to be able to identify when a student needs, a little extra check-in, or maybe needs to go see the counselor before there is a crisis, we can really help teachers and schools to increase their capacity to be able to do this. And that is part of our role. It's not only to serve those in greatest need, but also to help and empower and build the buffer zone in the mild to moderate states that can actually be managed in many ways by a school mental health professional that may not be a psychiatrist. We know that suicide is not only the second leading cause of death in young people, it's the #1 preventable cause of death. We know that 1 in 6 of our youth experience some kind of mental health condition or mental illness. Less than half receive adequate treatment. Some start treatment, many don't continue treatment. And schools are actually where the mental health concerns are most likely detected. A lot of the systematic review work in this area has been done by people like Kimberly Hoagwood, consistently showing that among youth who identify getting mental health support, 75% get it in schools, with only 25% in the clinic or general medical sector. So that's why school psychiatry is important for all of you watching this webinar, not just those of us who consider ourselves to be school psychiatrists. We also know that it's kind of hard to get started in this biz if you haven't done it before, but it's actually really kind of fun because we are welcomed in school environments. School staff, if we understand their culture and their community, the offers of support can be very welcome. Sometimes just sitting in on school district committees, which are all happening right now. Schools are going to be opening in some form over the next several weeks. You have the opportunity to provide free mental health talks to the school community. Take your 3 minutes of fame, go talk at the school board. And if you attend a meeting, say an IEP or a 504 meeting for one of your patients, you might find yourself invited back to sit in on a student that is not yours, but for whom the parent may want an outside consultant. And this is how we got started in schools 20 years ago. We started partnering to provide talks, but also to provide free consultation. Of course, this was done in partnership with our hospital and our medical school. So we felt like we could at least lend a helping ear, be someone who is a listener, who doesn't really have a competing interest, but who could maybe lend some expertise and experience around what might be getting in the way of this student accessing the curriculum, particularly if it's because of a mental health reason. Leading a support group for teachers can be very powerful. Often initial volunteer efforts evolve into paid opportunities. This is actually how one of my colleagues got very involved as a fellow. She started leading a support group for teachers. We then hired her as a school faculty. She's now one of our main supervisors, Maura Kessler, who came from Northwestern. And so as Erica has on the slide here, often initial volunteer efforts can evolve into opportunities that can actually be sustained. Now, my colleague, Steve Adelsheim, who is the Associate Chair for Community Engagement here in the department at Stanford, they did a study looking at several hundred students in their Youth Advisory Council for the Stanford Center for Youth Mental Health and Wellbeing. And these are some of the themes that were highlighted there. These were students mostly in the Bay Area and mostly in Santa Clara and San Mateo counties. But a few of the things that are highlighted: social isolation, decreased access to community support, because some communities are really not able to physically connect. They may or may not have the ability to put on a mask and go to someone's house and take a socially distanced or physically distanced walk for social connection. Often there are barriers to seeking their mental health care if they don't have connectivity, although most of us have gone to telehealth, even working with low-income communities, because they can often view us from their phone. Sometimes having privacy can be a challenge when you have 2 or 3 families living in a single space. Obviously, the other challenges that Erica touched on that are very true here in the Bay Area: economic distress. I talked about the close quarters within the family, and then the media reporting, which just seems constant. One of the interventions is to really turn off the media in order to be able to have a little break from it. And then ways to minimize risk, increasing access to these connections. In schools now, they're going to be coming to you all as psychiatrists for ideas. We're highlighting some of the ideas toward the end, but these are ways to mitigate some of the risk, and in particular, focusing on the vulnerable, the most vulnerable of our populations, those who've had previous exposure to loss or to suicide, those with mental health challenges, those who are members of sexual or gender minority youth groups, and then in particular, really trying to get our media and our messaging to be consistent from the school district across the schools. Again, this is a place where the superintendent might actually give you some bandwidth, because you're a dispassionate but very interested party, especially if it's where you live. If you have children there, you may be very passionate, but you want to go in very calm, know the science, know what's out there. ACAP has a lot of good resources, as does APA and the National Center for School Mental Health, which I'm going to highlight in a moment. But they would like to get your opinion. I think we can stay well within our lane, focusing on the mental health aspect, but remembering that we don't just think about children and students in a vacuum. We think about their teachers. We think about the other school staff. We think about their parents, because they're all part of the school community. So some of the other ideas that are very important to highlight here, and then I'm going to turn it over to Erica to finish this up, is just the idea around equity and mental health priorities. This is an opportunity for us that really can put a focus on the entire community and communities, plural. So some of the general principles to keep in mind: adopting school schedules that can provide the kind of in-person instruction that's safe and maximize the number of students possible. Many districts now have finally started getting on board with later school start times. Many of you are aware of that AAP document that came out a few years back. No earlier than 8:30 for high schools, and middle schools now, I think it's going to be 9 or 9:30 for many districts. Focusing on equity and mental health priorities can close some learning gaps and re-engage students who are at the greatest risk of dropping out. Erica highlighted those kids as having the worst outcomes, losing up to a year of their academic progress. It can help high school seniors get on track and stay on track, with all of the attention now to diversity, equity, and inclusion and anti-racist policies. There are now a number of different resources that we have as psychiatrists that we're going to highlight toward the end here on adopting these kinds of policies and practices. It also can help us to improve engagement and communication with parents from across the demographic spectrum. So I think I just have 1 or 2 more slides left, and I'm going to turn it back over to Erica. Some things to keep in mind as we try to improve distance learning. Again, I keep talking about providing the ongoing teacher support and professional development. Lots of different resources coming out, not only through ACAP and the APA, but through the National Association of School Psychologists, the NASP, the National Child Traumatic Stress Network, NCTSN, the National the Center for School Mental Health, which we're going to highlight in a moment here. So really, practical is what works. So what we're going to do is we're going to read about this stuff and see all the resources, but then we want to curate that for our school community so that they don't have to search around too much, but they know that what they use is going to be very practical and useful. And then I think this is my last slide. I'm going to turn it over to Erica. Consider ways to reach students who don't have internet access. So Boys and Girls Club is very big in one of our communities here around providing safe and distance learning for online technology, and then developing procedures to increase access to technology, like loaning devices and partnering with internet companies who may be willing to provide free access or low-cost access to a school district in order to make sure that all their students are able to access the curriculum. And so with that, I am going to turn it back over to Erica.
So again, just a few more strategies for you in terms of ensuring that we have equity and that we're prioritizing mental health for our students. Make sure that students with special needs and English language learners are getting sufficient supports. Find ways to continue wraparound support, such as access to free meals during times when schools may be closed. Help school staff to highlight their roles as trusted adults. In some of the consultation that I'm doing to schools right now, I really emphasize that right now, it's not so much about the academics, it's about the relationships. And so we talk to our school staff, teachers, and principals about strategies to prioritize relationships and trust. And that can be through strategies such as one-to-one meetings between teachers and counselors, or between students. Encourage teachers to organize study groups so that the students are interacting with each other, and then the teacher can pop in and assist with assignments as needed. And even though you're on distance, that's still a way to preserve some of that important social interaction. And then helping sites to create forums to discuss stress management, mental health and stigma. And Dr. Joshi has been involved.
Shout out to Gun High School for the Changing the Narrative column. If you just search Changing the Narrative Gun High School, you will see all the beautiful work they've done over the past 3 to 4 years, where you've got everyone from the principal to a favorite teacher to captain of football team talking about how they struggled and what they did, who helped them, how they developed resilience. It's okay to not be okay. When you hear that message, when you read that message from school leaders, from stakeholders, from opinion leaders, like, the popular kids who are willing to talk about their own struggle and how they got better, it's very powerful. And this positive messaging has been very important as Gun High School has really been leading the way since having some suicide clusters about 10 years ago. But they really have done a terrific job of, as they say, changing the narrative.
It's a wonderful, specific personal example. Again, in terms of trying to prioritize those interactions between students and trusted adults, help teachers to ensure that they make time at the beginning of regular class or group study interactions to ask students how they're doing and how they're feeling. And there's actually some really nice free software, such as this closethegap.org reference that we have here, that actually helps to structure teacher check-ins with students remotely. And there are some students that are not that comfortable with webcams, so ensuring that teachers understand that there may be some students who are shy about that. And finally, intentionality is crucial. And so one would hope that for the majority of school districts across our country, as they begin to reopen this fall, whether remotely or in person or some hybrid, that a real priority will be reconnecting, re-engaging, re-establishing trust at the start of the school year. Because for a lot of kids, this last spring was very jarring. All of a sudden, schools were closed. In some situations, kids went on spring break and then just never came back. And so there were not good ways for kids to have closure, to say goodbye to classmates, to say goodbye to teachers. And that kind of trust and relationships will need to be rebuilt. Ways to address inequality. So we talked about ways to address distance learning. Here are some ways to address inequality. We want to make sure that we're having schools implement culturally responsive and sustaining curricula and school practices. We want to support educators of color and provide them with extra support and preparation to enter the classroom. We want to improve equitable access to advanced coursework. There's a lot of research that suggests that students from disadvantaged backgrounds are often not challenged as much because there's an assumption that they wouldn't benefit from more advanced coursework. So ensuring that there's equitable access to advanced coursework for all students, reducing over-reliance on suspension as a form of discipline. It's a whole nother topic, but important. And allocate resources to schools based on need. So meaning we got to do some redistribution of resources so that those school districts that have fewer resources get some boost, get some raising, get some lift up. Ways to improve mental health. So there are something called relationship mapping tools. There's actually a free one online from Harvard if you just Google relationship mapping tools, which is a way for schools to figure out which students may be more isolated and disengaged from the school community, and then you can target those students to try to bring them back in and re-engage them. Find ways to connect and develop relationships between students, teachers, and peers. Consider screening processes to identify students at risk. However, it's really, really important that if a school decides to screen, they have resources to deal with the students that end up being identified through the screening. The worst possible thing you can do is do screening, identify students, and then not have resources to help those students. So you want to make sure schools are ready before they start to implement a screening process. We already talked about social emotional learning should be there in the curriculum for all students. And then mindfulness has been an important and really helpful technique and strategy within classrooms. And you can Google mindfulness strategies in classrooms and come up with 15 million different websites with all kinds of neat little techniques and tools. You want to ensure that there's a comprehensive system of Tier 1, Tier 2, and Tier 3 mental health supports. This is kind of the lingo of schools, the tiers. Tier 1 is prevention. Tier 2 is targeted, focused, oftentimes small group intervention for specific needs. And then Tier 3 is the most comprehensive and most individualized mental health supports. You want to make sure we think about providing wellness supports for our school staff. Our teachers and principals are under tremendous stress right now. And so things that you can do to support principals and teachers and staff: drop in office hours, either virtual, in person, for teachers with a school counselor or school psychologist. There's a really nice teacher well-being curriculum that's been developed by Dr. Jeff Bostic at Georgetown, who's a prominent member on our schools committee. And he just very generously gives out the school curriculum to anyone who's interested in implementing it in schools. It's a well-being curriculum, like a 12-week or 10-week curriculum to do teacher support, and then support groups for teachers. So, in summary, we've thrown a lot at you. We hope at this point in time you realize that the current COVID-19 crisis and related school closures have highlighted disparities that already existed in specific populations of school-age youth, but actually now are even worse because of the COVID-19 crisis. That changes in educational delivery models due to COVID-19, particularly switches to remote or distance learning, may impact student mental health, as well as increase disparities in educational progress. However, there is a lot of hope. Specific policy strategies and tools can be used by schools to ensure that all students make educational and developmental progress. And we, as child and adolescent psychiatrists, can play a really important role in supporting schools in these efforts. So we hope that you will choose to be one of those school mental health child psychiatrist advocates. And to help you on that journey, the last few slides here are just some really awesome resources for you to take a look at if you would be interested in helping schools. And lastly, a few other references that document disparities in distance learning. More references. And your ACAP School Psychiatry Committee, are a huge reference for you. So we have open meetings. We allow anybody who's interested in school mental health to participate in our meetings. All you need to do is email me or Shashank, ERYST@med.unr.edu, and
svjoshi@stanford.edu. You can also go to the ACAP committee website. You can click on schools committee and there'll be an email for Erica and myself if you're interested in joining our calls. And we typically meet the second Thursday of every month from about 8:15 Pacific time till 9:15 Pacific time. So 11:15 Eastern till 12:15. And all are welcome. We have learned so much from people who have joined our calls, even if they're not officially on the committee yet. They are doing really important work in schools. And so we really welcome anyone who has an interest in this work or anyone who wants to learn more about it. So with that, thank you all. Thank you to the ACAP staff for helping us out, Carmen, Emily, and Walter. And we look forward to seeing you for the virtual conference in October, either through this format, but especially through live streaming. The Schools Committee has several offerings that will be featured. So thank you, everyone. Be safe, and good luck as school starts very shortly.